That's your prepper tip of the day. We have a patient waiting in green room, my friend Dr. Phillip Meyers DC. Dr. Meyers is a chiropractic physician living and working in my hometown, St. Louis, Missouri. Simple way to get started. Make that first phone call, set up that first private, no-charge consultation. Call his office at area code 314-878-6868. Good morning, doctor.
Good morning, John. How's today?
Well, it's rainy. Got a pretty good-sized thunderstorm. I think we'll make it through the first hour. By the beginning of my second hour today, I think I might get shut down by a violent thunderstorm. How about you, sir?
Oh, I hope it's not going to come through here because it's really nice right now, so we'll see.
Well, look at the radar. Well, doctor, what direction you want to go this morning, sir?
Well, my wife and I got to spend a really amazing Mother's Day weekend, and one of the things that we did, we just decided to go rent a movie, and so we rented the movie Concussion with Will Smith about the chronic traumatic encephalopathy concussion disease. Have you heard about this movie?
I have, yes.
Okay. Yeah, so it was a phenomenal movie, and it really sparked a conversation in my office about head injury and even the fact of non-head injuries and how the brain can truly become inflamed and swollen, and it's not noticeable on any tests, but it creates a lot of hormonal, physiological, psychological, cardiovascular problems in people's lives, and you can't even measure it on like traditional CT, MRI scans, things like that. It's only recognizable, through an understanding of the symptomatology and through functional neurological testing to get a clear understanding. It's like, oh, okay, yeah, it's coming from your brain. It's not coming from your thyroid or your adrenals. So where is the tissue where the causative factor is truly coming from? And so it's really sparked a really great conversation here at my office on that, like all day yesterday. That's everything we were talking about. And a lot of, from the adjustment standpoint, it's like what happens when the brain gets swollen or inflamed? I mean, that's just from maybe excitotoxins or from chemtrails or from GMO foods. Forget that you never had a head injury or a whiplash or anything like that. Didn't play any type of contact sports. And then if you did play contact sports, you have that going for you as well. Even motorcycle, bike riding, contact sport. I mean, the amount of jarring that happens from dirt bike riding on the spine, that constant whipping of the cervical spine into that brainstem area, that would create the same type of overall symptomatologies over time, maybe to a less dramatic effect, but eventually it will sneak up on you. And what happens when all that accrues is the cranial bone suture system, where each cranial bone connects to each other. They look like little sutures, like stitches. Right. And that system literally breathes. It breathes. So when you breathe in, that cranial system expands. It opens up. When you breathe out, that cranial system contracts. It gets smaller and more condensed. And it creates a pumping action for blood, nutrition, and functionality within your brain. To think clearly, to see clearly, to hear clearly, to have balance, to have equilibrium, to then help control your entire digestive, hormonal, cardiovascular system. When you have anything along the spectrum of any type of brain swelling, inflammation, or concussionary type responses, that those suture bones literally do not breathe. they get stuck in a respiratory state of either inhalation, so they're stuck open, or an exhalatory state where they're stuck closed. That creates an imbalance within the body system, showing up as crooked teeth, showing up as blurry vision, showing up as imbalance in the equilibrium state within the inner ear, because those are all the suture bones that work with this respiratory process of breathing. And I mean, the list can go on and on. And so when we're dealing with how we correct the spine, because we correct it through that cranial system and through the upper cervical spine at the brainstem level, we open up and help close down that respiratory response so that the body can actually breathe better. And you've said this many times on our show, that after your sessions here, you feel like you breathe better. And you're like, I didn't even know wasn't breathing better.
Well, doctor, there's different points in a person's life where it seems like these things would be different one from the other. In a developing boy, for example, the stability of the skull at different points in an adolescent boy as opposed to a mature man.
Oh, well, absolutely. Because in fact, that's really interesting that you say that, because it all depends on your developmental stage. It was your proper tip of the day. It was talking about fear. And we've talked about fear in one way, and I've talked about it through that vagus nerve reflex, we call the fear paralysis reflex. However, the fear paralysis reflex has nothing to do with the consciousness level of fear. The part of the body that deals with the consciousness level of fear is the state of development that you were in when you had the issue in the tissue show up through a chronic inflammatory response that either accrued over a short period of time, became an acute issue, and then just never got corrected, or something that lasted over a long period of time and just became a state of doing that you are in. Just for example, eating McDonald's chicken McNuggets over a span of 15 years will create a developmental stage retardation of how your body neurologically corrects itself because of the excitotoxins in those foods that affected the neurotransmitters and the digestive tract and the hormonal system of the body. What happens is if that whatever developmental stage your psychology stayed in, it will respond in a fearful manner and not see itself for its true potential. And that's the other side of fear. And that's the fear that you were talking about, is your body literally it's not a paralyzing fear like the fear paralysis where you don't see your ability to experience a joyful response. That's the fear paralysis. This fear has to do with the inability to see yourself as your greatest potential and something less than who you really are. Where that's where the opposite side of it that comes in is shame. So the fear reflex, the fear system is extremely affected in this. And then you put a warrior in that state, a football player, a soccer player, a high-end athlete, or an athlete in any way, shape, or form. What is the one big thing that they say? Have no fear. Go head first. Go ahead. Go straight ahead. Well, then when you're having, it's complete contradiction in the psychology of it all. It's like you have this fear of not being able to see yourself for your highest and truest potential. and you're supposed to go head first into the situation, whereas when you literally have a head injury that is affecting you, you put the fear aside and then push through the symptoms. And what was really interesting, that was the psychology of all the athletes that were talked about in this movie, Concussion. They're athletes. They're warriors. They should be able to push through whatever is going on in their body. And unfortunately, what was going on is the issue was in their head, structurally affecting the psychology and the biology of their body. And just like we talk about with the autistic spectrum, from ADD all the way to autism, I bet you, and as this work comes out, because it's only been since 2008, since CTE has been equivocally diagnosed, is they're going to start recognizing that there is a spectrum of concussionary responses all the way up to the highest of CTE. I'd say CTE would be like the highest spectrum, like autism, whereas then there's your ADD is at the lowest spectrum of autism. The responses of the lowest spectrum of CTE will show up probably maybe as a cardiovascular problem or an ability to have a good, full respiratory response and heart rate variability, which I see all the time here. And guess what? 100% of the time, guess what I'm adjusting is the respiratory response and opening up the cranial sutures of the skull, which would be the same adjustments that you would do for someone that has a chronic traumatic encephalopathy. So it's the same thing when you're dealing with a person with ADD. Guess what you're doing? You're adjusting these same neurological reflexes in the cranial suture bones, and a person to the whole spectrum of autism. Guess what you're doing? You're adjusting the respiratory responses of the cranial suture bones. One just is further down the tubes than the other, has more physiological deprivation going on in their body, in their mind. It's just a spectrum, though. And I'm betting, and I put the bank on this one, that the whole thing from excitotoxins and environmental pollutants all the way to full-fledged concussionary head traumas, traumatic brain injuries, it's all this one huge spectrum. And diagnosing it, yay, fun and dandy, until the proper treatment protocols reach the general public and even the scientists in here. I got on the phone immediately. I got on the emails and phones immediately trying to find Dr. Amalu's people to contact him. And I wrote him an email yesterday like, dude, we need to talk. Because, yeah, you're diagnosing this. You've figured it out. Now, and the thing was, and I really hope I get it on this level, because even though the amount of credentials this guy has are insane. Mm-hmm. And insane. And even him, at the time of this diagnosis, was looked at as like, oh my God, you're crazy. This is completely crazy. You're a quack. You're a voodoo doctor from Nigeria. And but now here's the thing: the care plan for this whole thing is going to be outside conventional medicine. You cannot fix this with drugs. They tried. I mean, listen to the amount of drugs and psychotropics and painkillers and this and that they were pumping these football players with. Did that fix the CTE response? No. They ended up committing suicide or killed themselves or died really early from the complications of CTE. Drugs and surgeries will not fix this. This is a this is a non-medical treatment protocol. And I bet all they're going to start going with right now is physical therapy, and if they're really attuned, they might do equilibrium and eye cross-crawl stuff. Still, that does not, and I can tell you that from a fact from a chiropractic neurologist, those type of exercises do not fix that respiratory response. They will only work to the degree that the neurological system will receive and perceive the movement exercise that they're giving. You're talking then 15 months, 2 to 3 years for the neurological system to catch up to the receiver-perceiver response to the nervous system. Whereas when you do it the way we do it here at our office, you're getting it done in weeks. So it's going to go beyond conventional medicine, and anybody that's dealing with this stuff needs to recognize that.
Hold that thought, Doctor. We have a break. Call numbers 800-313-9443. We'll be right back. Right back in there, sir.
Well, hopefully everybody's still here with us. That was a quite long pause.
It was.
So, anyways, this, like we talked about on the break. So, people that are coming back here, we've been talking about chronic traumatic encephalopathy, the concussion disease, and how there's a spectrum of that. And even though you might not have, and like I said, I only say this because I see what the adjustment procedures that we're doing. When the body is under stress and has traumatic injury on the body, the neurological system compresses itself and literally loses its respiratory response. Now, that will affect how your body thinks, how your endocrine system, hormonal body fires and works. That will create aches and pains that throughout the body that happen. And so with the people that have had concussions, let's just keep it simple. People that have had a concussion, a whiplash, a head trauma, your body, your skull, the place where your brainstem comes out of the bottom of your skull down up the upper cervical spine area, that system does not move and or breathe properly. And it will create a continual chronic trauma to the way your body functions over a period of time. And as that happens, you will see more and more decreasing effects of your body's ability to do what you want. And things will show up neurologically. I mean, the thing is that this could have happened when you were 30, 20, and not show up until you're 50 or 60. And that's what they were showing within the movie Concussion, is you had these professional athletes in their prime of 20s and then dying by the time they were 45, 52. So if you take that that's the major spectrum. If you take it from the lower spectrum, where these injuries could occur within their early teens, 20s, because that's where you're playing most of your sports, and then these things will then show up for you when you're in your 65s and 72s. And I say that because also you're looking at environmental toxins, the things that exacerbate the inflammatory cascade response, anything of the GMO foods, the Roundup poisons, the chemtrails, the excitotoxins from your sugar-free foods and your all the different labeled toxins that are in what we call our foods. Those things exacerbate and create added stress to the neurological system, creating more of the neurological deficits that occur. So, yeah, it happened when you were 20. High spectrum, you're going to show up when you're 40, 52. Low spectrum, you're going to show up when you're 65, 72. So this is going to happen unless you actually get the system corrected. And that you have to get it corrected through actually working on the respiratory responses of the neurological reflexive system that runs your entire body. We call them the neonatal reflexes. We call them cranial suture opening exercises. I mean, there's a billion different names for them, but no matter what, your body has to open up that system so that nutrition, oxygen, water, and anti-inflammatory neurological immune function can fire. Let's take this one step further. So you have, you're somewhere on the spectrum of the concussionary response and traumatic brain injury response. Add that to bacterial and viruses and molds and alkaline environments creating high nagalase enzyme. And remember, the nagalase enzyme is the enzyme that keeps the bacteria, fungal, and molds and viruses healthy so they can continue living in your environment. Well, what that does is that knocks out your immune system, keeping you stuck in a chronic inflammatory response state and high allergenic state. So your body and your nervous system is going to continue to stay inflamed and swollen and degenerative. So even if you've not had, so then let's take that a step further, and let's say you never had the concussionary responses, but now you know you've been exposed to those excitotoxins. So now from the time you've been exposed to those since you were probably an infant, your issues and your tissues are going to show up when you're in your 20s. So what are those issues going to be? That's going to be anxiety and worry, heart rate variability issues, digestive problems, leaky gut, ammonia gut, chronic back pain, chronic neck pain, headaches and migraines, blurry vision. And look at it this way. How many people now in our society wear glasses? A lot. It's almost a thing. 1 of every 2 people probably wear glasses or contacts. Is it that God just gave us crappy eyes? I don't think so. Something is in our environment and in our lifestyle and the way we're developed that is creating an imbalance in the visual field, in the occipital lobe of the brain, where the brainstem and the cerebellum work for balance. That's an issue.
It is, you're right.
So you just look at these spectrums. It's coming from all the same stuff. We're just giving it more fancy disease names.
Well, Doctor, you're doing a good job of analyzing some of these issues, and what are the solutions?
Well, from my standpoint, what I do with my clients is you have to get these neurological systems corrected. Again, eating. This is why I say this is because people come to me. They have wonderful diets. I mean, literally wonderful diets. They are by the time they've come to me, they've fixed the dietary process. They're on a good exercise protocol. They're smart people. And the system that they show up with is so fatigued that they show up with so many different organ systems that are literally have no energy in them. And we correct them by correcting these neurological reflexes through the specific cranial and upper cervical adjustments, and then support through either mindfulness training, exercise protocol training, nutritional lifestyle shifting, bioenergetic medicine, frequency-based detoxification and rebalancing of the nervous system. That is what fixes it. That is what gets the body better. The toys are toys are toys, and but how you utilize the technology to your advantage is what's going to set you apart from the next person. And what we provide at our office is that advantage. And so we all are on these spectrums. I need to be very clear on that. me, you, your wife, my wife, our kids, everybody's family, we are all on this spectrum. CTE, highest spectrum. Autism, highest spectrum. Cancer, highest spectrum. Lowest spectrum, anxiety, worry, fear. Digestive disturbance, low back pain, neck stiffness. A little bit of a headache, migraine. Asthma, low spectrum. Clumsy child, low spectrum. We are all on these spectrums. What are you going to do about it? Are you going to allow that spectrum to build a momentum and get to a higher spectrum and wait till it shows up in your 30s, 40s, 50s? I'm tired of seeing people come to me, they were fine until they were 65, and then at 70 and plus, they go, pew, down the tubes. It's not old age. It's the spectrum getting worse. We are not designed to die that early. I mean, history doesn't show that. History shows that we live a long time. This human body is designed to live a long time. We're not. And then you add quality of life to that. Well, if you're degenerating because of these spectrums getting worse and worse and worse due to it just staying there over a long period of time, let's just say nothing else happens to you at 30. And you lived a perfectly non-traumatic life after that, but never corrected it. Your body's still stuck in that respiratory response. It's going to continue wearing and tearing down the system because you're still moving and doing and going and thinking. And eventually it's going to wear down that pathway that's neurologically locked in a respiratory state, a movement state, a thinking state, a being state, a doing state, an eating state, whatever. It continues to go down the tubes because that's how you're continually to live your life, whether you know it or not. And the thing is, it can be unconscious and it'll be corrected, or unconscious and it can get corrected. I know a lot of people that are completely aware of their issues and they do nothing about it. So it's not a lack of consciousness or a lack of awareness a lot of times. Sometimes it is. And a lot of times things will get corrected and it was completely unconscious. Oh, wow. It just disappeared. What happened? I don't know. It was somewhere unconscious in your brain, and once the pathway got opened up, your body cleared it. Then there's those other issues that you're so aware of and that never go away because the system you never work through the opening of the channels, really learning to quiet the mind, opening up the heart, doing all those types of things as well. The medicine's gonna change. It must change to a full spectrum awareness system that truly cares for the human body, the human mind, the human soul at the same time. And, oh, that's your profession. Oh, that's your profession. Oh, that's your specialty. I mean, there's two different specialties for the kidney. I mean, one single organ has two different professions.
No kidding. Why am I not surprised?
It's crazy. And so it's like, okay, why don't we start getting back to that the human body is the human body and it's one huge system and work on it from that state. So that's what we do at our office, and that's why I love doing these shows and talking about things with you, is to gain awareness and then gain action.
Well, awareness in the absence of action is actually an exercise in futility, Doctor.
It is. Bingo.
Absolutely.
So, and it's so many things can happen, and I mean, I just took care of a lady the other day. She had an underlying sense of depression her entire life. I mean, literally. So she's like, I cannot remember a time that I did not have this. I mean, so you're talking conception to 1, 2, 3, 4, 5, 6, 7 on through. Ended up being that she literally had a twin die that she didn't know about.
Really?
In the utero. Complete traumatic loss of a twin soul that literally knew you from the beginning of time, that knew your deepest desires of your heart and everything, is no longer in your life, but then you didn't realize she was gone. No wonder why she had depression. But it was so unconscious. It didn't show up until she was 42.
Here's our last break.
Let's keep it local. If you've had a concussion, if you are in contact sports, if you have had a whiplash, if you've been knocked around, you are now on a higher spectrum, period. So it's time to start getting these things worked on and corrected. So if you're a physician listening to this show, take action for your clients. If you're a person that's had these types of issues, take action for yourself. There's lots of people in the United States. If you want to work with us, please give us a call, 314-878-6868. We're here to help you get out of that spectrum. If you start, no matter where you are on the spectrum, if you start correcting the issue, the spectrum disappears. And literally, people's migraines and headaches can disappear from these issues within a couple weeks. If you're on pharmaceutical medications with that, it'll take a little longer because you have to deal with that issue. However, if you're not, you get through quicker. And these things there's a really hard way to diagnose these. So even if you have these types of symptomatologies, if you've had this type of experience, more than likely you have it. And then to functionally see it through functional diagnosis outside of MRIs and CTs and stuff like that. And I can't wait for the technology that these things can be diagnosed quicker and sooner. So we can then also, again, it's about the treatment protocol. It's not drugs and surgeries that's going to fix this. It never has been. It never will be. I don't care how fast and great the technology is to diagnose it sooner. Diagnosis technology and treatment protocol technology is completely different. We have the technology to care for it and to treat it and to reverse it. Knowing that you have it at a particular age and sooner, that technology is coming. But if you've had the issues if had the events that would create the issues, you already just take action. Why wait for the diagnosis? If it ain't broke, don't fix it. Well, if you've had the event, it's broken. Or it's breaking.
Well, having that foundational knowledge as a beginning point is not optional, is it, Doctor?
No, it's really not optional. And breathing's not an option. However, when your body's stuck in a breathing respiratory rate standpoint that creates an interference pattern within your brain, neurological system, hormonal system, and digestive tract system, yeah, it becomes a problem. But correctable.
Well, that's the key to it there. It is correctable.
It's totally correctable. You're not a victim. So,
Doctor, thank you. We'll have you back next Friday morning. Appreciate it.
Look forward to it.